So hi Nikki, how are you feeling now?
Not good. I'm in a lot of pain.
So the pain, we looked at your chart and your ultrasound results. So the pain that you have is from what's called a DVT, or blood clot in your legs. It's like behind your calf. So normally that clot would go away on its own, and that's what's causing your pain and swelling. But it could get bigger, or sometimes might break off and travel up to your lungs and cause a PE or a clot in your lungs. So that can cause a lot of breathing trouble. So neither of these two things are things that we want. So you might wonder how we treat this DVT. We're going to put you on a blood thinner medicine called Warfarin. You swallow your tablets every day, and it's based on your blood levels, so we adjust your dose up and down depending.
Your first visit about why you're on warfarin will be with your healthcare provider or advanced practice practitioner. The reason you are on warfarin will be explained to you at this time. Once you are started on warfarin therapy, your care will be monitored by the pharmacist or other healthcare provider in the clinical setting. The person monitoring your warfarin will give you further education about how to take this medicine. You will be given instructions regarding nutrition, blood level testing, as well as dosage changes. You're probably watching this video because your doctor has prescribed a blood thinning drug called warfarin, also known as Coumadin, to either you or your family member. Many people take blood thinners. You may know some of these people or have heard them talking about this medication. We're going to help teach you what you need to know about warfarin and help keep you safe. You may be wondering what these drugs do and why you have taken these medications. These drugs are often called blood thinners, but your blood doesn't really get thinner or thicker. This medication prevents your body from creating blood clots. The term anticoagulant better describes this drug. Let me explain this term. Think of it as two words, anti and coagulant, which means against clotting or keeping your blood from clotting. Blood clots are usually helpful. Your body naturally forms blood clots to stop bleeding after an injury like a cut or a scrape. This is an important safety feature of your body. But sometimes blood clots form or get stuck in the blood vessels where they are not wanted, and this can be dangerous. Blood thinners, or anticoagulants, like warfarin, are used to keep unwanted clots from forming and also to keep clots from getting bigger. The most common reason people are on warfarin are because they have had a deep vein thrombosis, or a DVT, pulmonary embolism, or a PE, stroke, have a heart condition called atrial fibrillation, or have had a heart valve put in. Now, a DVT is a clot that forms in the vein, which is a type of blood vessel, deep inside your body, usually within your lower leg or thigh. Common symptoms of DVTs are pain or tenderness in your leg, cramping, usually of your calf, swelling of your leg, ankle, or foot on the side where the clot is, warmer skin around the area of the blood clot, or discolored skin that is pale around the affected area. It may be pale, reddish, or bluish in color. A PE, or a pulmonary embolism, is a blood clot that's stuck in your lungs. Sometimes this clot was in another part of your body, like your leg, known as a DVT, that is broken off and traveled to your lungs. Now, common symptoms include shortness of breath or fast breathing for no reason, chest pain, as well as coughing. Sometimes you do experience spitting out blood. A stroke happens when blood flow is cut off to a part of your brain. It is caused by a blood clot, but sometimes also from bleeding in your brain. Common symptoms include weakness or not being able to move one side of your face or body, tingling or no feeling in your legs, sudden vision changes like blurred or blackened vision, confusion, a very bad headache, as well as losing your balance. Atrial fibrillation, or AFib, is a type of abnormal heartbeat where the top part of your heart beats faster than the bottom part of your heart. This can cause a clot to form in the heart, which could break free and travel to the brain, causing a stroke. Blood thinners like warfarin can help keep the clot from forming in your heart and lessen your chance of having a stroke. Some people's heart valves become damaged and they are given an artificial valve to replace their heart valve. These patients have a risk of forming a clot on this new valve. This clot can break loose and travel to another part of the body, possibly causing a heart attack or a stroke. We hope we haven't scared you. Most people don't have any problems with warfarin. We're here to educate you about anticoagulants so you can take them safely and know what to do if you do have any problems. It is important to take this medication once a day in order to lower the chances of clot forming. Each patient is different and each patient requires a different dose of warfarin depending on how your body deals with clotting. This can be tested when your physician draws blood in the clinic or at the hospital. Your doctor may change your warfarin dose himself or may have you go to the anticoagulation clinic to check your blood levels and properly change your dose if needed. These dose changes are to lessen your chances of getting a clot. When you take your medicine, make sure it's the correct tablet your doctor ordered. Warfarin is available in many different strengths. Each strength, whether brand name or generic, has its own unique color and has the strength engraved in the tablet. For example, a 5 mg tablet is peach colored and has a 5 engraved on it. The generic is a different shape, but still a peach color, and also has the strength 5 engraved on it. Take your warfarin exactly as prescribed. The number of tablets you take will likely vary from day to day. A small change in your dose can make a big difference. Your provider will tell you how many tablets to take each day and may give you a dosing card that contains important information, including how many tablets to take on each day of the week. Take your dose about the same time each day. Use a pill box to keep track of your medicine. If you forget to take your dose at the normal time, go ahead and take it if it's within 8 hours of that time. If it's after that, then skip your dose and take it the next day at your normal time. Never double your dose because you missed it. Blood is taken by the bedside device, or it can be drawn and sent to the lab. Results from blood tests will allow the physician to properly adjust your warfarin dose. There are many things that can interact with or affect warfarin and your INR, including other medicines, alcohol, and your diet. You should avoid or limit alcohol consumption as it can interfere with your warfarin. Many prescription medicines, over-the-counter medicines, and herbal products can increase or decrease the effects of warfarin in your body, potentially increasing the risk of bleeding or clotting. It is very important to tell all your medical providers, including doctors, dentists, and pharmacists, that you are taking warfarin and of any changes to your medications. Do not take any aspirin or aspirin-like products such as ibuprofen unless instructed to do so by your physician. Tylenol, or acetaminophen, in moderate amounts is usually safe for most people to take for pain or fever. Avoid herbal products as they can also interact with your warfarin. If you are unsure whether you can take a medicine or another product, ask your physician or pharmacist. For safety, you may also want to carry a wallet card or wear a medical alert bracelet stating that you are taking warfarin. Here are common medications that can interact with warfarin and affect your INR. Notice that certain medications can increase your INR, which may lead to a high risk of bleeding, or can decrease your INR. This can increase your risk of forming a clot. Your INR must be in therapeutic range in order to prevent clot formation from occurring. Now let's talk about certain foods that can interfere with warfarin's blood thinning ability. There are a few foods that have high levels of vitamin K. Vitamin K helps increase your body's clotting factors. Foods rich in vitamin K include leafy green vegetables, such as spinach and kale. If you eat these vegetables, it is important to eat them as a consistent or weekly basis. If you do eat these vegetables, it must be eaten in the same quantities every day in order to prevent fluctuations in warfarin management. If you greatly increase or decrease foods high in vitamin K, let your healthcare provider know right away. All medicines may have side effects including blood thinners. Since warfarin keeps your blood from clotting too quickly, there may be an increased chance of bruising or bleeding. A small bump may cause easier or larger bruising, and a small cut may bleed longer. So be careful not to get hurt, fall, or bump your head. You may get a nosebleed more often or notice your gums bleeding after brushing your teeth. Try to use a soft bristled toothbrush and don't brush too hard. To help keep from getting cuts while shaving, men may want to use an electric razor. If you hit your head hard, or have any bleeding such as nose bleedings that does not stop, or if you have signs of blood in your urine or stool, call 911 or go to the nearest emergency room. If you have any signs of blood clots or stroke, call 911 to get to the nearest emergency room. Always remember to let all your healthcare providers, including your dentist, know that you are taking warfarin in order to lower your chances of bleeding. And remember, if you have any questions, ask your healthcare provider.